Hello, relatives. Welcome to this week's Schlagbyte for the week January 7th, 2008, entitled Chinese Medicine. On my recent trip to China, we visited Beijing's prestigious University of Chinese Medicine. It is the premier teaching facility for traditional Chinese healing practices in the entire world. It's under the direct supervision of the Education Ministry. Its highly qualified teaching faculty bring in students from all over the world. The campus has 18,000 students, 1,900 of whom are from overseas. And the university now sponsors English-speaking training programs with universities in England, in Iran, Mexico, and Indonesia. I don't know anything about traditional Chinese medicine, although as a medical student, I was fascinated by a film that showed a woman undergoing a complete removal of her thyroid using only acupuncture anesthesia. After the gland was removed in a largely bloodless field, she was helped to sit up, and then she proceeded to climb down from the operating room table herself. It was an impressive demonstration. My own interest in traditional medicine began in the 60s when I first came to work as a physician with the Indian Health Service. Over the next 20 years, I learned how to integrate Western and traditional views of healing. As the chief of psychiatry at the Phoenix Indian Medical Center, I invited Native American medicine men and women to come to the hospital, gave them space to work with patients and their families. We instituted a traditional talking circle as a weekly therapeutic gathering and built a sweat lodge on the hospital grounds. But this was an Indian hospital, and therefore they were receptive to these ideas. But in most American hospitals, there is little encouragement to include other healing practices. I was interested in seeing how the Chinese medical system integrated traditional practices and decided to visit the campus even though I had no appointment. I arrived with my wife and two close friends, found some non-Chinese medical students who I'd hoped spoke English, and I asked them where the international school was, which they pointed out to me and gave me the name of the dean. Dean Chen greeted us warmly and invited us to join her in the conference room. And we introduced ourselves. I told her of my experience and interests, and she arranged for us to meet with the medical director of the international program, Dr. Ma. I can just imagine the likelihood of that happening in a U.S. medical school or hospital. The greeting was cordial. Dr. Ma was a small, vibrant woman, maybe in her late 30s, early 40s, spoke English well, and was remarkably candid. We talked about healthcare availability in China, and I was surprised to learn that there is no universal healthcare. There is actually a growing disparity in the healthcare in urban and rural areas, and it's a source of increasing social strife. Ironically, it's pretty much like in the U.S. Those who can afford it and or are insured, they get excellent care and choice of hospitals. But most Chinese cannot afford it. And the common folk who don't have insurance, they scramble for what it is they can afford, which are herbalists and street doctors. But when it comes to the integration of healthcare practices in both Western and traditional Chinese medicine, or TCM hospitals, the Chinese come from a place of mutual respect. Both hospitals have integrated their staffs. Doctors here routinely prescribe medical qigong as a health maintenance program. This is an aspect of traditional Chinese medicine that coordinates breathing with various physical postures. Often, people do it in groups. They practice everywhere, in parks, on the street, under trees. Coming together in community to get energized through the coordination of breath and movement is a common traditional healing practice. It's the idea that harmony between the body, mind, and spirit, or the worlds of thoughts and actions and feelings, they need to be in balance if you are to live fully. We need to integrate that awareness in our lives. Find a practice. Doesn't matter if it's qigong, yoga, meditation, tai chi, dancing, drumming, chanting, line dancing. but it's got to get you away from the ordinary ways of seeing, breathing, and moving. Do that and you will face life's stressors a whole lot better. Have a great week. There are some last-minute openings at the upcoming workshop this weekend with Brad Keeney, a first-time, one-in-a-lifetime experience. Check it out on the website. Have a great week. Remember, we're all connected. Nobody makes it alone. I say this for all my relations. Mitakuyasi.